Hi, I'm Dr. Chintamani Gautam from Nepal Yoga Academy. Today I'm talking about Kapalbhati. This video is especially for FitMind channel. What is Kapalbhati? Kapal is skull, Bhati means shining. So in Kapalbhati, actually we use our tummy area, especially belly button area. So we actively exhale by using those muscles, and your inhalation will be passive. You don't try. Autonomous system does that. So for the beginners, while doing this, especially 1 second, one stroke is really effective and acceptable. First, I'll show how to use tummy for exhalation. So use only navel area especially. Forcefully you just suck your abdomen in, or you just press in, and then you just exhale with sound. Sound is very special here. And one more thing, there are two ways to create the sound while exhaling. One is from the nostrils like this, so you cannot really feel friction. So other way is you can control from the epiglottis area from your throat. So that gives effect to your brain and then face. So while creating that sound, you can see the differences between both. This is less effective when you create from the nostrils, and from the throat is really effective, like whistling. Okay, so would you like to try with me for 10 times? Okay, get ready. Are you ready? Okay, start with me. With sound. 5 more. Great. I hope it was clear for you. Now I show you 50 times, 50 strokes, how to do it. So you sit in comfortable postures, and if you understand 4 special tips before you do Kapalbhati, it would be really helpful to minimize obstacles and then mistakes. So number 1, flatten tummy in the beginning. That helps you during the practice and then to feel comfortable and not to get tired. Second special thing is always control from the throat or epiglottis area. 1 second, one stroke is really effective, and then you can continue easily. And while inhaling, so good accent, so active inhalation, active exhalation, passive inhalation. So 4 tips: flatten tummy, control from the throat, 1 second, one stroke, and active exhalation, passive inhalation. So sit in comfortable position, relaxing your shoulders, just look forward. You can do with closed eyes or open eyes, either way, but your head should be straight, spine erect. Okay, now get ready, just understand. Ten more. Tenth, and inhale deeply and smoothly exhale and relax for a few seconds. So you can practice 100, 150, even 200. You can increase frequencies, but very important thing is, so do you feel comfortable or equal effect or equal effect from the beginning to the end? If you feel after 10 or 20 a little bit hard, or you cannot manage equal sound or other things, means that's not good. That's why better do less, improve more, because for benefits from the Kapalbhati, you should not feel tired unnecessarily. There should be constant and the frequencies all the time. So you can practice from 5 minutes to 10 minutes. You can start in the beginning from 1 minute. So increase timing and frequencies. So people especially having heart disease and high blood pressure should be careful. Other than that, people can try easily. Thank you very much for watching this video. Namaste.